Guys, we're back, and today we're going to be talking about COVID-19, also known as the SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome Coronavirus 2, discovered in December 2019. It's an enveloped RNA virus. But how is it transmitted? How does it go from person to person? It can be through direct or indirect contact with infected people or surfaces. The main mode is through respiratory droplets, so that's by coughing, sneezing, talking or singing, and inhalation of those droplets, which is why when we wear masks, we cover our nose. Going on to the incubation period, what is the incubation period exactly? It's the time between exposure to the virus and symptom onset. So it's estimated to be within 1 to 14 days, and most cases are 5 to 7. But what actually happens when coronavirus gets into your body? There's no confirmed mechanism, but studies suggest it's most likely due to it binding to the ACE2 receptor, which is a receptor expressed in many tissue types, including the lining of the lung, and specifically on cells called type 2 pneumocytes. But what's the big deal? So, coronavirus binding to this receptor inhibits the normal function of that receptor. And what's the normal function? Well, it converts angiotensin II into other molecules. So when you've got coronavirus, you're going to get an excessive accumulation of this angiotensin II molecule. But why is that a big deal? Well, increased angiotensin II in the lungs causes something we call pulmonary vasoconstriction, which is where the blood vessels in the lungs are narrowed inappropriately. Angiotensin II also causes increased membrane permeability, which in turn causes inflammatory and cytokine-induced organ damage. And cytokines are basically these molecules that an excessive accumulation of them can cause a lot of damage. And so examples of pro-inflammatory cytokines include IL-1, IL-6, TNF-alpha, and they cause a cytokine storm, which is not good news because it causes something known as diffuse alveolar damage, which is because it causes an accumulation of inflammatory cells in the lung tissue. And that's not good for oxygenation of the lungs. What else do these particles do? So the viral particles can also cause increased epithelial cell apoptosis, which is basically means these cells are dying, and so that causes a loss of type 1 and type 2 pneumocytes, again causing alveolar damage, which in turn causes severe damage to lung tissue, which can induce acute respiratory distress syndrome, which we see a lot in severe cases of COVID. So that's all very, very dismal, but there is treatment. The treatment depends on the disease severity, of course. As most of you may know, most people with COVID have mild to moderate symptoms, and this can actually be managed at home, as you would with any other common cold. But some patients, they may be hospitalised, but they don't require supplemental oxygen, and that's kind of a balancing act. So patients may or may not require treatment. It might depend on if they have underlying disease or not. The next type of patient are those that are hospitalised, but they are requiring supplemental oxygen. For that, yes, you are going to have to treat them. What do we treat them with? Well, there's options. So you can use remdesivir or dexamethasone or both. But what if the patient requires oxygen via a high flow device, or if they're requiring mechanical ventilation? Then you want to think about dexamethasone and not remdesivir. So why do each of these treatments work? Looking at remdesivir first, so it's an antiviral, and you've got to kind of go back to the viral life cycle. Coronavirus, for it to survive, it needs to make copies of itself, and to make copies of itself, it needs RNA polymerase to join the nucleotides together. So that's what RNA polymerase does, but what remdesivir does is it blocks that chain, because it's added onto the chain and no other nucleotides can be added onto it. And that means you're not going to get copies of the virus being made, and that means it can't infect other cells, and hence it stops disease progression. How about dexamethasone? Dexamethasone is a corticosteroid. It's used to treat a lot of things, and it's also used to treat COVID. It's anti-inflammatory, which is great because it reduces systemic inflammation caused by severe coronavirus disease, and it also inhibits the cytokine storm that we were talking about earlier, which again is good news. An important thing to remember is obviously a lot of the treatment of COVID is largely based on the symptoms, so how a patient presents. So if they present with respiratory failure, you're obviously going to be treating them with oxygen. If they present with an AKI, you're going to consider treating them with continuous renal replacement therapy. And now going on to what we're all talking about, I guess now, which is the COVID vaccine. I'm going to talk about the two main ones that are being offered in the UK right now. The first one being the Pfizer vaccine. The Pfizer vaccine is an mRNA vaccine. It's not live. And how does it work? So the mRNA enters dendritic cells and macrophages, which are basically both cells involved in the immune response. It contains instructions on how to make a part of the spike glycoprotein, which is found on the surface of SARS-CoV-2. And it can't cause the disease itself. It's very important to note that. So what the dendritic or macrophage cell does is it displays one of those glycoproteins on its surface, and that in turn causes your immune response, and antibodies are made, T cells are activated. And what that means is if you are infected with coronavirus after getting the vaccine, your immune system is like, oh, I know this, and it calls all of its buddies, they all have the antibodies ready, and you're gonna be able to get rid of the virus, which is great. How does the Oxford vaccine work? Well, unlike Pfizer, it uses DNA, and this DNA is made from a weakened version of adenovirus, which is a virus that causes the common cold, but it's modified to look more like coronavirus. And again, it's the same mechanism of action, so you get antibodies being formed. So that's it really, and thank you so much.